Let's do MCQ of neurology. A patient with raised ICP shows bradycardia, hypertension, and irregular respiration. This is A. Kernig's sign, B. Cushing's triad, C. Babinski reflex, D. Decorticate rigidity. Earliest sign of increased intracranial pressure: A. Dilated pupil, B. Projectile vomiting, C. Altered level of consciousness, D. Hypertension. Best position for a patient with raised ICP: A. Supine flat, B. Trendelenburg, C. Head elevated 30 degrees, D. Prone. A patient suddenly develops facial droop and arm weakness on one side. First action: A. Give aspirin, B. Check blood glucose, C. Start oxygen, D. Give antihypertensive. Drug of choice in status epilepticus: A. Phenytoin, B. Diazepam, C. Carbamazepine, D. Valproate. Classic sign of meningitis: A. Kernig's sign, B. Babinski sign, C. Romberg sign, D. Trousseau sign. In spinal shock, the patient initially presents with A. Hyperreflexia, B. Flaccid paralysis, C. Spasticity, D. Clonus. Glasgow Coma Scale score of 8 indicates A. Mild injury, B. Moderate injury, C. Severe injury, D. Normal. A patient with meningitis should be placed in A. Airborne isolation, B. Droplet isolation, C. Contact isolation, D. Reverse isolation. Unilateral facial paralysis with inability to close eye suggests A. Stroke, B. Bell's palsy, C. Trigeminal neuralgia, D. Myasthenia gravis. First symptom of Parkinson's disease: A. Rigidity, B. Tremor, C. Bradykinesia, D. Dementia. After head injury, patient has lucid interval then unconsciousness. Diagnosis: A. Subdural hematoma, B. Epidural hematoma, C. Subdural arachnoid hemorrhage, D. Concussion. Patient presents with deviation of mouth to one side and inability to close the eye on affected side. What is the diagnosis? A. Upper motor neuron facial palsy, B. Lower motor neuro facial palsy, C. Trigeminal neuralgia, D. Stroke. In bacterial meningitis, CSF shows A. Increase protein, B. Increase glucose, C. Increase neutrophils, D. Clear fluid. In Guillain-Barré syndrome, CSF finding A. Increase cells plus increase protein, B. Normal CSF, C. Increase protein, normal cells, D. Decrease glucose. A comatose patient withdraws from pain but does not open eyes or speak. GCS score will be A6, B7, C8, D9. Decerebrate posturing indicates lesion at A. B. Red nucleus, B. Cerebral cortex, C. Brainstem below red nucleus, D. Spinal cord. A patient with spinal cord injury above T6 develops sudden hypertension, bradycardia, sweating, and severe headache after bladder distension. Most appropriate immediate action: A. Give atropine. B. Lower head of bed. C. Empty bladder. D. Start dopamine. A patient has loss of pain and temperature on right body and left side of face. Lesion is in A. Thalamus, B. Medulla lateral, C. Cortex, D. Spinal cord. During a lumbar puncture procedure, the on-duty nursing officer must position the patient correctly to facilitate needle insertion and cerebrospinal fluid collection. Which of the following is the most appropriate position for the patient? A. Patient lying on their side with legs flexed, knees drawn to the abdomen, and head flexed with chin touching the chest. B. Patient lying on their back and turning forward. C. Patient with legs extended, knees touching the abdomen, and head in extended position. D. Patient lying on their side with head turned to one side.